and a player in the same game. It's not fair to private insurers.
Thank you, Ed. Now we will have one final opportunity to listen to both sides as they provide us with their closing argument. The Republican side, the Democratic side, won the coin toss to determine the speaking order, and they have chosen to go second. So the Republicans will go first and provide us with our first closing argument.
Well, first, James, I'd like to thank you and the Political Science Society for helping organize this event. I'd like to thank the Democrats for participating, my teammates, Ken Juby and Channel 6 and Channel 10 News for coming out here today, and everyone who came out here to watch this debate. As we know, our healthcare system is a problem, and it has major problems, but you also have to look at the major potential it has. 70% of Nobel Prizes in medicine have come from the United States. And it hasn't come from any public option either. It hasn't come from Medicare or Medicaid. It's all come from the private insurance industries who are trying to push the envelope when it comes to new technologies. 5 of the most 6 important medical decisions in the past 25 years have come from the United States. They haven't come from other countries that offer public options or universal health care. Our government already controls 60% of spending on health care in the United States already. That's including Medicare and Medicaid. Both of those systems, as I mentioned before, are broken. Like I said, Medicare is $32 trillion in debt. And before, Ben said that hopefully Medicare can pay for itself soon. If they can pay off $32 trillion in debt, maybe they can. Like I said, they've made too many promises. And that's a CBO statistic, by the way, $32 trillion. I'm not making that up. Also, there's many other governments that are broke, many other government programs that are broken. I mentioned the U.S. Postal Service, Medicare, Medicaid again, Amtrak, a train. They can't even run a train system. Social Security. If you work right now and you pay in Social Security, you're not going to get it when you retire. You're not going to get a cent of it. CBO predicts it's going to be broken by 2017. That's less than 10 years. It's going to be gone. And yet the government insists on throwing money at a problem that cannot be fixed. You know, these numbers are unsustainable, and it's going to be our future that's hit the hardest. And unless you actually look and read the bill, unlike our congressmen and senators, they have not read H.R. 3200, and I can guarantee it. It's 1,000 pages long. 1,000 pages long. They didn't read it. Nancy Pelosi continued to just push this socialist health care idea that it's going to better our economy. The United States provides most technological advancements in medicine to every single country that has a universal healthcare system. Without our healthcare system and our private insurance industries, like I said, push for innovation, they would not have MRIs, they would not have CAT scans, they wouldn't have the newest cancer treatment. These are all things, these are all benefits to our program. And public option, like I said, is a Trojan horse that is just going to slowly creep into the private industry and slowly drive these companies out of business because they can keep costs as low as they want, because it's been seen time and time again. The government is inefficient. The government does not care about prices. We're $10 trillion in debt, thanks to George Bush. And I think that in the 2008 election, Barack Obama promised us change, and the Democrats promised us change, a movement away from George Bush's continuing spending and wasteful spending, and continuing to break the backs of our future generations. I have yet to see any change come from this president and this Congress.
Thank you, Ed, and the Republican side. Now for the Democrats' closing argument.
As we talked about this healthcare debate in the last year and in the years even before that, we've looked at it from the perspective of, will it increase competition? Will it help business? Will it help the average American? Is it socialist? Is it not socialist? We've gone through all these avenues. However, put politics aside for a minute and think about it in these terms. In America, if you're hungry, do we make sure you have food? Yes, because it's not acceptable in America to not be able to eat at night. If you don't have a house, do we make sure you have shelter? Yes, because it's not acceptable to leave somebody out on the street. Well, in America, if you get sick, how come we don't make sure that you get well? That shouldn't be acceptable in America. I don't think it's right that 45,000 Americans die every single year because they don't have health insurance. That's not a statistic. Those are lives. 45,000 lives lost because of an insurance plan. An insurance plan written on paper to make money. 45,000 lives. They were mothers, fathers, grandparents, children, friends. All gone. Lives from this earth that can never come back because they didn't have health insurance. I don't think in the greatest country, the richest country on the face of the earth, we should find it acceptable to leave people without health care. I once heard a story of a man who was a young man, only married for a short time. He had a young son, 2 or 3 years old. He came down with kidney cancer, and there was a experimental treatment that the doctors wanted to try to see if maybe it could save his life. They thought there was a decent chance. And when he went to get it approved from his healthcare company, they denied him treatment. He died a few months later, and now his wife is without a husband. His child is growing up an orphan. No father to play catch with, to take him fishing, to teach him how to ride a bike. How do we feel to think that somebody out there has had to go through this because they didn't have health insurance? I'm saying put politics aside, put aside capitalist theory, socialist theory, put aside all the technicalities, all the academics, all the configuring and planning, and look at it from the perspective of 45,000 lives lost. Lives that were members of families, lives that people cared about. Thank you.
Thank you, John, and thank you to all our participants. Let's have a nice round of applause for excellent job, both sides. I am sure that this information has provided us and helped a lot when it comes to understanding this complex health system. As we have seen, there are many facets to this argument, and it's important to understand and both sides when we come to make a decision on what is right for our country, what is right for us as human beings. I'd like to also thank the Republican Club and the Democratic Club, Rich Harris, Kathleen Deegan, Ken Juby, thank you for bringing our local media outlets here. It's important to know that the students are going to be affected, our students today are going to be affected by health care in the road that is coming. Finally, thank you, Brian, who was our timekeeper. He kept us all in line. And I think we can have 2 minutes or 5 minutes if anyone has any questions for either side or any member of either side. All right.
I answered everything.
Oh, you certainly did a good job. Thank you again, and have a good afternoon, everyone.